Thanks for joining us here on The Real Story. I'm Emma Wolforst. It's now been 5 years since COVID-19 was declared a global pandemic. While many might feel as if the world has mostly returned to normal, for those in the healthcare sector specifically, there are lasting impacts. Here with me now to discuss the challenges they still face and what they want from the state, SEIU 1199 President Rob Burrill and SEIU 1199 member and home nurse Johanna Alabi. Thank you both so much for being here.
Thank you.
So Johanna, I want to start with you. How long have you been in this industry? Just tell me a little bit about your background and about what your career has looked like so far.
Okay, so my name is Johanna Alabi, and I've been a CNA for 15 years.
Wow.
And, I work in this field because my mother introduced me to, taking care of people. She was a pastor, so she decided that she would actually, assigned us to one person to take care of. And that's how I fall in love with taking care of elderly.
Wonderful.
And that's where I'm at today.
Wonderful. So, this past week, SEIU 1199 members rallied at the state capitol with fellow healthcare workers, faith leaders, and even some elected officials to mark this anniversary that I noted, 5 years since COVID-19 was declared a pandemic. Rob, tell me a little bit about that event, why you wanted to have this rally at the Capitol.
Well, the event brought together about 500 of our members across long-term care industries, so that's home care and nursing homes and group homes. Folks are coming together because this is a budget session, and while group homes and nursing homes are private sector agencies, they are publicly funded primarily through Medicaid dollars. Wages have really lagged, benefits have been cut, care standards are declining in large part because the state's fiscal guardrails prevent the state from moving dollars to where it's needed to support with staffing, supplies, and other services to long-term care residents. So we were bringing workers together to talk about those challenges and to advocate for greater funding.
And this conversation around the fiscal guardrails has been one we've been having for the 3 years now, the past two sessions. So I do want to get more into some of those specifics. But Johanna, obviously there were challenges prior to the COVID-19 pandemic, but walk me through what you're seeing now. What problems have persisted for you?
So right now, with COVID-19, 5 years now, and we are still, struggling. Healthcare workers are, we're working 80, 90 hours a week just to put food on our table and to pay our bills, And, the resident that we take care of, they're just not getting quality care. There's days when I have to go in and buy soap out of my little bit of money that I'm getting, just to go and wash these residents so they can smell good and, and taken care of properly. And, the food quality is terrible. All the foods that they're getting is like canned vegetable, canned fruit. And, frankly, they're not eating it. So our nursing home residents, they're losing weight because they cannot eat what they're getting. And it's a cry out for help. This is not good.
Have you seen it worsen in the 15 years that you've been a CNA?
Yes, it's gone downhill. And when I said it's gone downhill, it's, the acuity of care is there, but the staffing is not there. So now we have to choose between, do I brush this person's teeth or do I feed this person a warm meal? And that's not how it's supposed to be. And, where the problems come from is the fact remain that a lot of people don't want to do this work anymore. Not because it's not a great career, but it's because they can't sustain it, they can't take care of their family because the wages are scandalous.
And I know the wages have been a big issue, have been a big conversation for years now. Rob, tell me what you're asking for this year in this longer session, in this budget session from state lawmakers.
So we're asking for about $550 million in funding for group home and nursing home workers. It's probably about 40,000 people overall, of whom we represent about 10,000. And the idea is a pathway to get workers immediately to $25 an hour. Why that wage rate? Well, frankly, in many ways, it's not enough, but it is significant progress from where people are at. People are currently making between 18 and 22. I was with a meeting of 60 of our long-term care members last week. I asked them, how many people in the room have worked a 100-hour week? 55 out of the 60 hands went up. I asked folks, how many of you have had a coworker who is employed, working full-time, but in some stage of homelessness? Half the hands in the room went up. People have talked about 83-year-old, 86-year-old employees still working, members of our union, folks who went through traumatic experiences during the pandemic and still are not emotionally and well in all the ways that they need to be. People have talked about having to live in their cars because they can't afford the cost of rent, in some cases with children. So when we talk about the conditions that both residents in long-term care and the workforce are enduring, we're talking about extremely serious conditions. $550 million is a lot of money, but we didn't get here all at once. We got here over 20 years of lean budgets, which are now landing on low quality of care and working conditions that people just cannot sustain.
And when it comes to those fiscal guardrails, as you said, years of lean budgets, we know the state wasn't in a good place fiscally, led to putting these guardrails in place, and then led to years of very lean, if at all, excess spending. We've gotten to a point now where the state is in a good place financially, and a lot of groups like yours have been coming for the past 2 sessions to the Capitol and saying the state has extra money, the state has this rainy day fund, let's give it back to residents in the state. As you said, though, $550 million is a large sum of money at once. Do you feel this session there's anything different in these conversations with lawmakers when we look at adjusting the fiscal guardrails or adjusting the way the budget might look?
Well, there have been some incremental steps, which we certainly appreciate and applaud. But given the scale of the challenges that we're facing, particularly as we're looking at the federal government moving extremely aggressively to cut Medicaid in ways that can hurt the state, quite badly. We really need lawmakers to step forward, to be bold, to be courageous, and to talk not just about raising the guardrails to have some more flexibility over $4 billion in funds that currently is in the rainy day fund, but also to raise some revenue. Unless we are comfortable with the idea of the federal government leading to a declining standard of living for long-term care workers, for long-term care residents, and for folks who are Medicaid dependent generally. That's 1 in 5 people in our state. Our leadership politically has got to take some very bold and courageous steps. And of course, our members, our 25,000 members in 1199 and the labor movement more generally, will support them in that effort. But somebody's got to stand up for working people.
And Joanna, obviously the main ask here is for that money to raise wages, because the whole point of this conversation with state lawmakers is taking care of those who take care of those in need. Yes. What would a wage raise like this, bringing your hourly up to $25, what would that mean for you? What difference would that make?
So the first thing that he will do for me is that I would work less. I could stay home with my family. Second of all, it will bring back other caregivers like myself back in the work field. So that way that our resident can now start getting quality care. Because, the fact remains that they left because they can't afford a family. They can't afford, to take care of their family. Now, if we get that good amount of raise, they will come back. And it would be very good because, now the resident will, again, get good care.
And what do you want state lawmakers to know as they're in the middle of this budget session, as they're, considering putting more money to the nonprofit sector? What do you want them to know?
I want them to know that the residents are suffering. The residents are suffering, and the reason for that is because people are not coming to this work field, and if they don't do something about it, there won't be anybody to take care of these people. Now, what would they do? So we're asking them to look at it, come to the table, and give us something.
Yeah. And Rob, you mentioned a little bit the federal government impact. We know there's been so much back and forth and prior to the session, a lot of state lawmakers and leadership told me that they kind of thought this session would be a wait and see because they didn't know what would be coming out of the federal administration in terms of cuts. Is that what you're hearing as well? And how difficult is it to ask for this at a time when we also have so much uncertainty on a federal level?
Well, I would say it's not difficult from the perspective of where our members' lives are at. I mean, when I talk about the experiences that I just related, members can't work any harder. You can't fit, if you work a 100-hour week, you can't work a 150-hour week. You can't work more than 2 full-time jobs. So our members are very, very clear that they want to fight to have better lives. They want to fight on behalf of their residents, and they want to fight to stand up to a federal government which is really moving in a very mean-spirited and cruel direction. Yes. Our members have said in no uncertain terms, if they need to strike in order to get movement out of our political leadership here in the state, to cause more attention on the ways that the guardrails are impacting the quality of life negatively for both working class caregivers and their residents, they are willing to do so. We hope that that is not what is necessary, but we will be prepared if that's what we have to do.
We know we've seen strikes in the past here. Last thing in our last minute here, what do you want people to know as they're following the session? Obviously, we're only into March now. This is going all the way until June, but any message to people of if they want to follow along what's happening, what's going on at the Capitol, why do you think it's important for them to stay involved?
Well, look, our state's budget determines so much about the quality of life in Connecticut. It determines everything from primary education funding to state colleges and universities, which are currently seeing cuts. Our transportation budget comes out of the state's budget. And of course, funding for all manner of healthcare services is through our state's budget. So again, we've seen year after year after year of lean budgets governing as if we are in a recession. We are not in a recession. The state is really flush with cash, and people who have been sort of waiting on the sidelines for 20 years for the state to begin to make some progress in the wake of the Great Recession cannot wait any longer. We are hopeful that they will hear the cry of many thousands of workers who are standing up and saying that they want some real movement from the state's political leaders.
Well, Rob, Johanna, thank you so much for taking a couple minutes. We'll definitely be checking in as the session continues.
Thank you.
Thank you so much.
Thank you. We still have more to get here, though, on The Real Story. The Department of Education officials announced sweeping layoffs this week as President Trump and new DOE Secretary Linda McMahon vowed to close the department entirely. What could this mean for Connecticut? We'll talk through state impacts coming up.